Hello, welcome to the dental practice. How can I help you today? You have an appointment? Okay, what's your name? And your first name? How do you spell that, please? Let's see. You said your appointment's for today? At what time? Okay, well, you're actually a little bit early, but we'll make that work, I guess. Let's see. I think I found you. Can you spell your name again for me? Okay, well, that's not the spelling we have. Looks like when you made your appointment, you spelled your name with 6 E's in a row. I don't know why you spell your name the way you do. No, it's definitely not an error on our end. I took this appointment myself, so I know that it's right. You just don't know how to spell your own name. Okay, so you are new to our practice. Welcome. I have some paperwork here. Let's see. Okay, we have your name. That's definitely correct. Alright, your address. And that's correct as well. Okay. And your date of birth. Alright. Okay, we have your phone number. That's the number we called to confirm your appointment with. Yes, okay. Alright, employer or school? Okay. Do you have dental insurance? Yes. Okay. Alright, can I see that card? Thank you. I'm just, let's see, going to run that through our system here. Okay, there you go. There's your card back. Anything that your insurance does not cover will be billed to you, of course. And we will find you, don't worry. Alright, do you have any secondary insurance? No, well, you should, but okay. Let's see, what is your reason for today's visit? General cleaning, okay. And your date of last dental care? 6 months. That long, 6 months ago? You should really come to the dentist at least once a week. Okay. Date of last dental x-rays. Okay. Former dentist's name. Okay. And their phone number. Oh, I know them. Do you have their home phone number? Because I would love that. No? Okay. Great. Check if you have any problem with the following: bad breath, bleeding gums, clicking or popping jaw, food collection between certain teeth, grinding teeth, loose teeth or broken fillings, periodontal treatment, sensitivity to any of the following: cold, hot, or sweets, sensitivity when biting, sores or growth in your mouth. No to all of those? Okay, well, we'll see. How often do you floss? Okay. How often do you brush? Okay, well, that should really be like 8 times a day, but okay. I guess twice will have to suffice. I'll be the judge of that, though. Let's see here. Have you ever taken any of the groups of drugs collectively referred to as fen-phen? Okay. Have you ever had any serious illness or operations? Okay. Have you ever had a blood transfusion? Okay. Let's see here. Check if you have or have had any of the following: anemia, arthritis or rheumatism, artificial heart valves, artificial joints, pins, etc., asthma, bleeding abnormality, blood disease, cancer, chemical dependency, chemotherapy, circulatory problems, congenital heart lesions, diabetes, epilepsy, fainting. I guess we have to finish this, don't we? Okay. Fainting, glaucoma, headaches, heart murmur, heart problems, hemophilia, hepatitis, high blood pressure, HIV or AIDS, jaw pain, kidney disease, liver disease, pacemaker, radiation treatment, respiratory disease, rheumatic fever, scarlet fever, stroke, swelling of feet or ankles, thyroid problems, tobacco use, tonsillitis, tuberculosis, or ulcer. No. Okay. List any medications you are currently taking and the correlating diagnosis. What are you taking it for? Okay. 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 Is that all of them? Because that's kind of a lot. Okay. You sure? All right. Please list any allergies you may have. None. Are you sure? Okay. I do have to tell you that I showed you this sign for our own liability issues. There you go. You've seen it, right? Yes. We are not responsible. Okay. If I can have you sign this, please, saying you saw the sign, everything is correct. Perfect. All right. Well, as we are short-staffed, I will be your hygienist and your dentist today. Definitely qualified. Here we go. Let's see. How did you hear about us? Cool. So you found like the flyers on the telephone poles? Okay, good. I was kind of worried you'd seen like the Google reviews. If you haven't, please don't Google us. You know, everyone has like a bad day, I guess. I know there's like over 6,000 like 1-star reviews, but they're all lying. So anyway, I will get you back and get you set up, and let's get into that mouth. Okay, so we are all back here. Let's just go over a couple of things really quickly. So I noticed during your intake, your comment on how frequently you brush your teeth. No, definitely a dentist. How frequently you brush your teeth. You said only twice a day. I highly recommend at least 8 times a day. So this is what happens. So this is like your tooth right here, okay? We have this outer shell, and if you get a cavity, we have to take the whole top off. I can't help it. That's just the way it goes. And that exposes this under part here. And then that part has to come off. And this is the squishy part. This is the root. This is not what you want to have to mess with, but I'm afraid all of that has to come out too. It's like little crab claws, doesn't it? Pinch. But all that has to come out, and then this whole tooth has to just get yanked right out. So, best way to prevent cavities is to really scrub down on your teeth really hard, as hard as you possibly can. And I noticed you also said you didn't notice you had like any bleeding of gums or anything. Well, I can't get this back together now. you said you didn't have any bleeding of your gums. You kind of want that because a good, healthy blood circulation in your mouth helps keep everything nice and healthy. So I really recommend, really just as aggressively as you can brushing your teeth. Like I said, at least 8 times a day. If you can do more, that's better, but just a little free tip for me to use. So let me get my tools out here. Are there any other services we can offer you today other than just cleaning your teeth? We do offer teeth whitening. We would be happy to do that for you. Like I mentioned earlier, your insurance may not cover everything, but almost dropped everything on the floor. That would have been a disaster. That's okay. We will happily send you a bill. So, yes, everything is definitely sanitized. We send out everything once a month to be sanitized. I know it's the end of the month right now, so, sorry about that. But, if you want to have the most sanitized tools, I recommend making your appointment like first appointment of the day on the first of the month. That way you get first dibs, but that's okay. Because when it's all done, everyone's mouth is clean, right? So there's really not a need for doing anything extra sanitizing wise. All right, let me get this little chart set up here. Are you having a good day? Well, hopefully that continues. We'll see. Okay. All right, clean that off from our last patient. Okay. All right, so I have stuff all up in here. Doesn't even belong in here. Okay, so this is your mouth. This is exactly what your teeth look like right now. That's what we're hoping for anyway. We'll see which ones have to be extracted or cleaned up extra or anything like that. We're going to take our mirror and look through all of your teeth. We're going to take our toothpaste and our toothbrush and brush your teeth for you. You're welcome. I have some dental floss. We will go through and floss all of your teeth. I will make notes on which teeth have problems, which teeth again need to be extracted, and I have a syringe there for an injection for some Novocaine. You're welcome. We still have some of that here. So let's get started. I have my dry erase marker on this side over here to make notes as I go. All right. So, okay. Do you have any questions before we get started? Yes, I've been doing dentistry for about the last 10 years. Only about 3 weeks for people though, but how different is it really? I guess we'll find out. All right. No. You don't need to use the restroom or go out to your car for anything. Everything we need is right here. Trust me, I'm a doctor. Okay, not necessarily dentistry, but whoever said my PhD in literature wasn't going to come in handy, definitely wrong. So let's start with, let's start with our mirror, and we'll just take a look at all of your teeth and see what we see. Open very, very, very wide as you possibly can. I mean, just open your mouth up all the way. Okay, let's see here. All right, that looks okay. All right, and over here. Keep your mouth open. It's perfectly normal for your jaws to cramp up and kind of lock up. That's okay. Let's see. let me know if you feel this. Okay. Okay. Does that hurt? Tingle at all? Alright, okay. Good to know. Let me just jot that down here in your chart. Well, doesn't look good so far, but let's continue on. I'm going to take some measurements here. Okay. All right. And how long have you had these teeth? Seriously? Like the whole time? I didn't even know that was possible. Okay. I will make a note that you are prone to telling fibs, so I will not have to ask you any more questions about your history because I know you will be lying about it. Let's make a note there. So. Whole time. Sure. Sure, Jan. Okay. All right. Let's see. A few more measurements. And you said your last x-rays were done when? Okay. Do you want to do x-rays today? I mean, we don't have like the lead apron or anything, so it would literally be like the full force of the x-ray hitting you. Are you sure? I don't mind. We can, there's no one else here. I can get you right on back. No? Okay, well maybe next time. Let me see. I think I want to do some scraping between your teeth here, so let's just... Yeah, this is why you need to floss several times a day. Keep that plaque from building up. Tartar is like tartar sauce. They're both gross. Nope, that's not an opinion. That is a solid fact. Okay. They teach us that in advanced schools. You know, I understand if you don't know that, but let me take a look. I'm not going to floss yet. I'm afraid you might bleed quite a bit. Let me go back through with our mirror here and note which teeth are going to have to be extracted today. Oh, definitely. Yeah, were you not prepared for that? Well, I suggest make your peace because you're going to be losing a few. Okay. Take this one out. Okay. So let's see. All right, and okay. Yeah, I'm afraid we're gonna have to lose like 5 or 6 today. And then we might have to have you come back to pull some more. I know. It's definitely not something I enjoy doing, but I'm not gonna lie, that paycheck from the insurance company is really nice. Okay. Alright. So these notes automatically transfer to your electronic chart, so there's no reason at all for you to read what I wrote. Let me just erase that, and I'll show you what we're going to be doing. Okay. Yes, the technology is excellent. All right, so, my friend, it looks like this tooth right here is no good anymore. Looks like we have some kind of gross gunk on it, so it's gonna have to go. I'm afraid these two teeth right here are also going to have to go. They have some kind of yellow gunk on them. Sorry about that. And this tooth back here also has some kind of a black growth on it. That's really gross. That's gonna have to come out. And let's take out these two as well. I don't have any replacement teeth for those, but we'll just imagine there's some kind of nasty growth on those too. So, how does that sound? I know it can be very scary, but you are in good hands. Trust me, I am a doctor. As I've said before, right? Yes. Yeah, they don't just give these little doodads out to anyone. Alright, so let's go ahead and give you your pain injection. We're gonna have to do I guess a shot for each one. So we'll do 6 of these, okay? Alright. And make sure you're still open really wide and we'll go. Okay, there's 1, 2, 3. No, this is technically not a new syringe, but you saw the health questionnaire we went over with you. We go over that with every patient, so all of our patients are definitely clean. Not a problem. 5, 6. I know. You know, people are so quick to just throw stuff away these days. We do wash it, or at least put some hand sanitizer on it. It's fine. And like I said, on the first of the month, every month, or the end of the month, technically, we send it all out, get it all sterilized, it all comes back, good to go. So, no need to worry your delicate little head. It's fine. Alright, I'm going to get our toothbrush here and our toothpaste. I'm afraid we only have one flavor, which is clean. That's the best flavor of all. And get some toothpaste on there. Let me... Oh, you don't like the flavor of clean? Well, that is why our teeth are in this state, isn't it? Open up very, very wide. I know. I can see you grimacing. It's going to hurt a little bit. Like I said, you really want to be aggressive and get in there. Maybe if you were more aggressive with your teeth brushing, this would not be an issue. You want your gums to bleed every day. It gets that blood circulation going. Okay. And you want to brush for at least 12 minutes every day. And stick your tongue out for me, please. Perfect. Okay, get that tongue clean. Do you ever brush your tongue? Because you should. I'm going to have to make a note and correct you saying you don't deal with bad breath, because that's definitely a lie. Alright. So, how's your mouth feeling? Is it starting to get numb? I'm just going to make some notes here. Okay. Yeah, I didn't use a lot of numbing agent because, again, it's very expensive, but I figured it would be fine. The armchair has armrest for a reason. You can really grip in there if it starts to hurt. Alright. Oh my gosh, you know this mask is so hot. I'm gonna have to take it off. Whew, mercy. Maybe we should just have our dental agency open in like the winter time. Okay, so while I'm waiting for that to finish taking effect, what I want to do is, mercy, very hot, go over the teeth whitening with you. So, you know, I've gotten pretty good look at your teeth, and they definitely need to be whitened for sure. Because, you know, this is the color we go for. And I would say right now your teeth are like this color right here. Pull that out, show you up close. So you see, that's not great, right? So we're gonna have to do quite a bit of whitening to get it leveled up to this. And I know some dentists would probably recommend doing that in stages, but I'm not gonna do that. I think we need to go from like this color all the way up to this color, if not this color, by today. So you can see there's quite the rainbow of colors there, right? Quite the range. So what do you think about that? Yeah. Let me see. Okay. All right. Yep. And here. Okay. So let's do that. Let's get your teeth whitened. Then we will go ahead and get those extracted and see if we can't find some fake teeth to replace those with. See if we can go and get those implanted today as well. And have you come out of here with a matching smile, and then you can come back later. We'll do a next round and get the rest of those teeth pulled because honestly, they're no good. All right. Shh. It's okay. It's okay. I know there's not many doctors and dentists out there that are going to be as honest with you as I am. So you just relax. You're in amazing hands, okay? I promise you. You're sure your insurance is current? Okay. Just wanted to be sure. All right, so let me go on and floss. All right. This is non-flavored. Open it really wide. Perfect. Okay. All right. And again, you want to be as aggressive as possible with flossing. Get down between the teeth there. I can see you've kind of been very gentle with your teeth and your gums, and I kind of think, honestly, that that's why things are the way they are right now. Like I said, you see those commercials where it says like 4 out of 5 dentists recommend this product or recommend this service. I'm the holdout. I'm the one that says, no, I'm going to tell the patients the truth. You need to be extra and more. What they're recommending and selling is not strong enough. Yep. I'm here for you. Okay? Trust me. I'm a doctor. Alright, so let me erase this round of notes that is finished uploading to your chart. Okay. You said you have somewhere to be? Okay, well don't worry, this won't take too long. I promise. We'll get these teeth yanked out and get you on your way. Patient is insisting we rush. Okay. just wanted to remind you of our policy here. And that's upside down. There we are. Okay. Not responsible for accidents or injuries. Seriously, don't be stupid. So, all right. Okay. Reminded patient of policy. Okay. So, let me get my glasses on. And get you some glasses to protect your eyes from the whitening treatment. Okay. All right, now it's going to be a little bit bright. And just going to go all on the bottom of your teeth here. Yeah, I know it's bright. You have the sunglasses. What do you want from me? You said you wanted your teeth whitened. This is the only way to do it. And your upper teeth now. Okay. All right. Okay. All right, that's not bad for round one. We will do that a couple more times as we're getting this extractions done. So, okay. Like I said, open up. Because here we go. Okay, you ready? No? You want a second opinion? For what? My opinion is the best opinion. I told you, I've been doing dentistry work for like 20 years. Yeah, I know I've only been working on like people for, a couple weeks, but what's the difference really between the dental setup between a person and a fish? Yeah, there's like none. Patient showing hesitation over my qualifications. Asking for a second opinion. Fine. I will give you a second opinion, okay? Here's a second opinion. These teeth gotta go. So let me just clamp this on for you here. Okay. Perfect. What are we slowing down for? What's the holdup? I don't understand. Yep, perfect. Thank you. Glad you got on board. Where did my pliers go? Here they go. Okay. Got me all frazzled. All right, and open up. Well, it's not coming out. Have your teeth always been this stubborn? I don't understand. I mean, it had a little bit of tartar on it. It should just pop right out. Yeah, I know I just brushed them. You want me to look again? Whew. Okay, we'll do another exam. Let's see. Mm-hmm. Okay. All right, let's see. That is interesting. Okay. Can you please open your mouth really wide? Thank you. You wanted me to look in here. Now you're not going to open your mouth. All right. Okay. And let's see. Okay, well, I will say they didn't look as bad this time around. I could barely understand what you're saying, though. It sounds like that Novocaine is starting to kick in. Okay. After brushing the teeth, the buildup was significantly reduced. I would still recommend getting those teeth pulled because that would be a great payday for me. What do you say? Please? I could really kind of use the money. No. Some people are so selfish. Okay. Patient refusing extractions. Fine. Well, I will say, after brushing your teeth, it looks like the nasty yellowness on those front teeth are gone. So those can stay for now, I guess. And the cavities got brushed away as well. I didn't realize that could happen. Maybe there was like a poppy seed. You just ate a bagel? Yeah. Must have been a poppy seed, as I suspected, on those teeth. So, okay, and I guess if we're not going to pull those, we may as well keep the last ones in there too. So, fine, we'll keep those. I did notice that you had some spots that are kind of worn through. So I would recommend getting like a night guard for grinding your teeth. There's a hair there. Sorry about that. And then you can get like a case for cleaning. Those come in handy because you definitely want to clean them. Yeah, I can definitely sell you those today. Your insurance does not cover that. It'll be like, you know, I'll give you a deal. How about $1,500 for the set? No, it's not like you can just like walk into Walmart and buy these off the rack for like $4. Definitely not. I'm trying to cut you some slack here, but okay. All right, you still have your glasses on. We're gonna do the next round of whitening here. All right. Oh, these are all wet. Okay. All right, and the lower teeth there. Okay. All right. Upper teeth. Okay. Alrighty. So that's better. I think that's all I can do for you today, I guess, if you don't want to have, like, you know, a really thorough job of me taking care of you with the extractions. But, you know, that's, where did my pen go? Here it is. I'll make a note against medical advice. You are choosing to keep your teeth. Because I do recommend, honestly, I would say it's better for everyone just to have all of your teeth extracted, but then I would kind of go out of business because you wouldn't need me. Although there's still gum issues. I guess maybe we can take a look at that closer next time. Against, hold still this chart, okay. Against medical advice, patient is adamantly refusing all extractions. Remember to bill for Novocaine injections. we didn't do 6, we did 8 to 10. Okay. All right. Well, is there anything else I can do for you today? Okay. Well, it's been a pleasure meeting you. I'm sorry I could not provide you the kind of care I wanted to, but, you know, I guess some people are kind of attached to their teeth. Little dentist joke there. If you wouldn't mind leaving us a review on Google, but only if it's like 5 stars. I swear we can't handle another negative review. All I'm out here doing is trying to help our patients. Not every, you can't force someone to accept your help though, so, you know, bless their hearts. One day they'll figure it out. But in the meantime, I have set you up with an appointment for tomorrow. Does that work for you? You have to check your schedule. Well, I've booked you in, and there is a $600 no-show, no cancellation policy. So, you know, either way, I get paid. But thank you for coming in. I will see you tomorrow.